If I could, let me have your attention, please, and we'll go ahead and begin our meeting. First of all, I want to thank all of you that are here today and for your interest in our work as we've gone through this, through our rescheduling and canceling and uncanceling and everything else. We appreciate you being here. And also, I want to thank all those folks who came when we had our hearings the other day and testified. We had some 27 or 28 interested people who talked with us, and we appreciate that. And also thanks to all of you who have provided information to us as we've gone through this process and worked on the issues that we're working with as we're trying to go through the budget process here. I also want to thank our subcommittee members. Some of them are here. Some of them will probably be in a minute. There's a lot of committees going on today, and as you know, it's just difficult to get something where there's no conflict. But thank all of you. Each member on the committee has been engaged as we've gone through this, and they've worked hard on the issues, and everyone has had some input as we've dealt with these issues. And I want to give a big thanks to our House Budget Office, and especially to our budget analyst, Margie Coggins, who had put in many hours of work to try to get us where we are today. And before we get into the budget, let me just make a comment to all of you out there who are interested in this. And I guess what I would want to say to you is there wasn't any way that we could do everything that you wanted us to do, and there wasn't any way we could do everything we wanted to do. But I believe and I hope that after you look at the budget that you'll believe this is a good budget and it's a good balance between our needs and our wants, and while working within the dollars that we had to spend. So with that, we'll go ahead and begin. And committee, I'm just going to go down the differences, and as we begin on the very first item there, the increase to the employer's share of the state health benefit plan, you're going to see this scattered throughout all the departments and agencies in here, so I'm not going to mention that each time. What I'm going to do is, you've all gone through this, I'm going to just go over the differences that we have so that we can get to those. First one would be under 17.3.1. This where we would restore the dental, vision, and podiatry services for adults and pregnant women. Without these funds, these clients would end up in the emergency rooms, and the hospital would probably be not compensated for the care that they would have to give to them. The next item, 17.3.7, this reduces the Medicaid cut to providers by 1/2. You remember these providers have not had an increase in more than 10 years. Under the next item, 3.12, this recognizes the February Medicaid fraud settlement with the vendor, where Georgia's award is $7.8 million. The next item, 17.3.13, this deals with the independent care waiver program. There's a lot of interest in this. We're able to put in $545,000, which will fund 33 of these much needed slots to help reduce the waiting list of 163 by 20%. And you'll remember that I don't think we've added any slots since FY9. The next item, 3.14, this is where we will go to 12-month coverage of the Medicaid eligibility from 6 months to 12 months. This will improve the health outcomes and maintains the medical home relationship. Georgia is only one of 2 states in the southeast that does not provide this 12 months eligibility coverage. And this is an expensive process, and the money that we have there, the 2.7, will be for 6 months of that program. And you'll also see this reflected in the low-income Medicaid a little bit later here. The next item, 17.4.11, reflects a cut to the department's administration budget of 1.6%. Next item, under 17.6.5, this is the House is recommending that we add $50,000 to the governor's recommendation. This is the Georgia Poison Control Center located at Grady Hospital. It serves the entire state. Last year they answered more than 100,000 calls and helped people to resolve these emergencies. Next item, 17.7.4. This is the restoration of the air emergency services to the northwest corner of the state. The next one, 17.7.7. This is a 6% cut to this program like we've done with the other programs. Next item, 17.7.8. This funds 2 new federally qualified community health centers from the priority list. 17.8.6. This removes the previous year's personal service lapse fund, $378,000. And under the Ended Care Trust Fund, the first item, that's 17.10.2, we've got language in there, no money, but what this will allow us to do, it provides for an amendment to the Medicaid state plan, which will allow Morehouse to maximize their state funds and prevent the funding issue that arose in FY11. The next item, 10.3, is a yes also, and this language requests that DCH to review if the current data used for determining the DISH funding is the most representative data for the hospital's current uncompensated care. The next will be in infant and child essential health treatment, 17.11.8. This restores $250,000 to the governor's recommendation. And what this will do, it deals with the Hemophilia Foundation is working to get their clients enrolled in this insurance program. It's the pre-existing condition insurance plan, a federal program. And this money is taking a little longer to make that happen. So this money is to make sure that they're able to continue to purchase the high-cost clotting factor in the meantime, and we'll talk about this down just a little further in another instance like that. Next, under 17.12.4, this is just an error in the governor's budget, and this transfers it to the correct program. And 17.12.7, this restores funds for the Children's First program. This is the program that helps children age 0 to 5 access preventative medical care. Under the infectious disease control, 17.13.5, this is the same thing, same kind of program as up above. This initiative moves 660 of our low-cost HIV/AIDS patients receiving state-funded medication to the federal pre-existing condition insurance plan, and the state will pay the premium, which will in the long run end up saving us money doing that. Under 17.15.1, there again, this restoration maintains the dental, vision, and podiatry services for adult and pregnant women, just like we talked about a little earlier. 17.15.6, this reduces the Medicaid cut to the providers by 1/2, as we discussed earlier. 17.15.7, this reflects the anticipated settlement collection receivable from pharmaceutical companies for error or fraud charges of $1 million, and then the next item reflects the revised drug rebate savings of 1.5. Under 17.15.12, this reflects additional bonus payments for implementing the 12-month eligibility reviews. And under the next item, 17.15.15, this reflects the latest Medicaid projections while providing funds for the Unemployment Trust Fund of $18 million and the State Health Benefit Plan of $70 million. The next item is 12 months coverage that we talked about, and that there again, this is for 6 months of the 12 months beginning January the 1st. The next item is 1.3 million. This initiative will cut down on the DFACS data entry and records verification by using existing records like WIC to determine eligibility, and this will be funding for the Express Lane eligibility project. Under the Peach Care, 17.16.4, there again, this reduces the rate cut to providers by 1/2. And then under the 17.16.6, this reflects the drug rebate savings that they pick up there. An item under public health formula grants to counties, 17.17.3. This eliminates the cut to the county formula grant and aid, some $2.4 million, just like we did in in 11, so we're saying no to that cut and restoring that money. Under the state health benefit plan, 17.18.2, there'll be this reflects a 13% increase in school system state health benefit plan payments for non-certificated employees. The next item, 17.18.8, this is through the recognizes additional claims submitted and reflected in FY11. We took more in FY11 than we did in 12 because it was our benefit and got a bigger return on that, or a bigger drawdown on that. And then the next item, 17.18.9, this provides for a 20% premium increase for the 2012 year plan, which begins January the 1st. And without this, we were looking at something like a 60% increase. The next item, 17.18.14, is a savings of some $21.8 million. This reflects an increased use of minimally invasive surgical procedures like appendectomies, gallbladders, and this sort of thing. And by using more of the minimally invasive procedures, it shortens the length of stay in the hospital, so there'll be a savings to be gathered from that. And then under the next item there, 17.18.15, this reflects a $100 million state fund spread throughout the agencies, which will generate another $34 million in federal dollars and other funds, and that's the reason for the $134 million. The under vital records, 17.19.3 is a cut of annualizes the cut from the FY11 amended budget. Under the Georgia Board of Physician Workforce, 17.21.3 just accurately reflects expenditure cut from the board's co-location. The governor has recommended the cut in the wrong place, and we're just making a bookkeeping entry there to straighten that up, and you'll see that down under 17.27 in just a minute. Next, at 17.21.4, there's a $5,000 savings there. This eliminates $5,000 in per diem saving from the elimination of that board. Under the Georgia Board of Physician Workforce, there's a $75,000 add there. This adjustment continues the development of new osteopathic residency programs with the Houston Medical Center. Under the 17.24, this money allows Morehouse to establish the new partnership with the Atlanta area hospitals for the purpose of maximizing their medical education state funding, and this would be them being able to draw down their federal dollars there. And under the Composite Medical Board, the 17.27.3, this is the $123,000 that I mentioned earlier. This accurately reflects the expenditure cut from the board's co-locating, and it was in the wrong agency. The net cut is the same right there. And ladies and gentlemen, that completes the presentation. Any questions or motions? Yes, sir, Mr. Chairman.
Might be recognized for a motion.
Yes, sir, Mr. Chairman.
Move to pass.
Okay, we have a motion. Is there a second? Any discussion? All those in favor say aye. All opposed, or say no. It passes unanimously. Thank you. And thank you all for coming.